especially in last 5 years, we are seeing a lot of young patients less than 30 years every month. Don't neglect the signs and symptoms.
Of late, social media has been loaded with so many ads and so many reels relating the food and outcomes related to cancer. Lifestyle affects cancer risk.
Definitely. Having good lifestyle is very, very important.
So the cancer is not only related to aged people, so it's distributed among children, youngsters, so any age.
And it affects financially, mentally, physically. All things.
Hi everyone, cancer is one word that creates fear instantly. But what is more dangerous than cancer itself is ignoring the early signs. Welcome to Brindavan MedTalks, where real doctors share real insights to help you take the right decision at the right time. I am Dr. Gururaj, intensivist at Brindavan Hospital, and today we are talking about cancer awareness and early detection. Joining me today is Dr. Nischal, renowned oncosurgeon at Brindavan Hospital. Welcome, Dr. Nischal.
Thank you, sir. Thank you for having me.
So, Dr. Nischal, before I go into the cancer per se, I want to ask you one personal question, which I ask most of my colleagues. Among all the surgical branches, why oncosurgery?
I'm a fan of being a surgeon. The idea of entering medicine was to become a surgeon for me. And as and when I went on studying surgery, so I felt the pinnacle of surgeon, being a surgeon, was being an oncosurgeon, that you do everything. You do most of the complicated cases, you do most of the difficult cases, and I wanted to be in that place. So that drove me to become an oncosurgeon as such.
So I can say it is more rewarding getting into the complex surgery.
It's rewarding even today.
Okay. You would be seeing many patients in the OPDs. Okay, but what do you feel where the awareness stands among the public regarding cancer?
Patients do know cancer nowadays, what it was 2 decades earlier. They are aware of it, but they have less knowledge about it.
Okay.
Because the amount of knowledge they gather is not from the right source.
Okay.
As it stands for so many things. So we tend to encounter so many times the questions and the doubts which are not so related to the disease or something like that.
Okay. The trend what I have seen is where there are many youngsters who doesn't do the health checkups regularly. They feel that I'm hitting the gym, I'm eating the right way. Okay, so they just feel health taken for granted and they feel that cancer cannot affect the youngsters. So how do you feel in your career, like the incidence of cancer is distributed?
I would say if you take last 10 years, a decade or so, especially in the last 5 years, we are seeing a lot of young patients. As such, our team treats around at least 3 to 4 patients less than 30 years every month.
Oh my God.
And in India especially, we are less aware about the genetics and the genetic testing because it is quite expensive as such at present. So we usually don't get the genetic testing, then especially in people who are normal. In babies, we do a lot of enzymes test and everything, genetic enzyme testing and all. I think in down the line, probably because we are all in the world, people are doing genomics and everything. There will be a set of investigations, common mutation investigation, which will be done upfront.
Okay.
I think that looking at that, I think over the time, we will be able to do that as the cost comes down and it is much feasible. And I say youngsters should be aware of their health, even though they are having a good lifestyle. Yes, you should have a good lifestyle. Because cancer is even preventable and postponed by having a good lifestyle, because it's a chronic disease like any other diabetes or anything like that. We should accept that.
What is the common kind of cancers do you see in your career, like the incidences of different cancers? Which is the most common?
Most common, I can categorize into 2 people, males and females ಅಂತ ನಾವು ಮಾಡ್ಬೋದು. And most common cancers also depends on the region. It is very affected by the region because each ethnicity is different genetic makeup and their dietary and lifestyle is quite different.
Okay.
So coming to our place, I think in and around Mysuru, wherever we see, and we see in females most commonly breast and ovarian cancers more often. And in males, we see more of GI cancers, oral cancers, stomach cancer. GI means stomach, pancreas, colon cancers, and even prostate cancer.
Of late, I have seen many kids going through chemotherapies and all. Do you want to highlight any on those children where the parents need to be aware?
See, most cancers we see in children are more of liquid tumors, we call it, like blood cancers, and even something called a lymphoma, which is lymph node cancers. Okay, so parents, anytime the child is anemic, they have less blood than usual, or they're having tiredness very quite often, and throwing unnecessary fevers in the evening, there is blood loss or while brushing or something like that, and they have some lumps or some swelling in their neck or in abdomen, so they should please visit their doctor.
So I would take from you that even the children or the youngsters, it's a red flag when they have certain symptoms and signs.
Definitely,
So they should not
definitely.
ignore it.
They should not ignore it.
Okay, so the cancer is not only related to aged people, so it's distributed among children, youngsters, so any age.
Definitely.
Okay. When it comes to this, okay, where there is no age bar, so what is that awareness the public needs to have so that they can pick it up early and they can consult a specialist?
Don't neglect the signs and symptoms. That is one thing. Whenever you get symptoms, each cancer has different symptoms. Coming from top, commonly oral cancers, non-healing, painless, I'm stressing this, painless ulcers are more dangerous than painful one. Cancer is usually painless in the initial stage. Only when it becomes beyond one point or that organ get compromised or there is nerve involvement or something like that, then the pain comes. So sometimes people think, sir, ನನಗೇನು blood vomit ಆಗಿಲ್ಲ, ನಾನು cancer ಇಲ್ಲ. No, that is in pictures, not here. So it is such that these are some of the symptoms, and especially in females, they have very big abdomen, especially ovarian cancers, they come with big ascites and so on. Don't neglect it. Especially females neglect their symptoms because they always assign it to their menstruation pains or something like that. So but whenever you have recurrent pain, 2 or 3 episodes, something like that, please visit your doctor so that we may find something and we can treat it.
Since the cancer is very important, what people are more feared is about the economic status, because cancer drains lot of finances as definite. So what is your insight into that?
I have seen that side of the story too, because my father was diagnosed with cancer and we went through the process when I was still a student. So I was in that side of the bargain. So I always tell patients that cancer it affects not only patient, it affects family, whole family, and it affects financially, mentally, physically, all three. So lot of new treatments are coming, lot of research is happening. So any new treatment comes, most of the research are done outside India. Okay, so when they come, new treatment comes along, they're quite costly till they have that patency or anything. So in that sense, it is quite costly, but our government and everyone are taking initiative. So the cost is coming down, but for the newer treatment, sometimes it is quite costly. And it's a process of 6 to 7 months at least, most of the cancer we treat. So they should be ready financially for that time, and always advise, so have health insurance. True. You should have health. That's what I told Allah. You should invest in your health. We have a insurance of 10 lakhs for the car. We don't have insurance of 10 lakhs for us. I would say city people around us, we even doctors, so many people, I see that. They're taken into account, I am doctor, okay fine, I will get the treatment done. No, it is not. So healthcare cost will be increased down the line.
So you may get ill or not, that doesn't matter, but being prepared is what matters.
See, your body is a machine. Machine is going to run out of something, or some part is going to get damaged down the line. So you should have something financially stable to get it repaired.
Of late, social media has been loaded with so many ads and so many reels relating the food and outcome related to cancer. Okay, so basically lifestyle, food habits, how is it related to cancer? Like,
see, I'm a strong believer of a healthy, good food, good air, and good water.
It shows on your face.
No, we also lack that actually. We don't. We are the worst. Doctors are the worst patients. I always say. But you need to. Food definitely influences our health, like in any other disease. Like I said, it's a chronic disease. It doesn't happen. You take a food today, you get cancer. No, it's a process. Your DNA gets damaged over the time. So for that to not to happen or to postpone that thing, you need to have a good diet, good lifestyle, so that you can postpone or you can even prevent having a cancer. I think in that sense, I think newer generation, especially I would say Gen Z, new Gen Zs, not the alphas, I would say, they are more health conscious.
Okay.
They are more health conscious than what we millennials were. I would say we millennials, I always tell Gen Zs, you are lucky people. You don't need to worry for bread and butter and a shelter. It's already done for them. Probably that were not worrying about that made them more. And I read an article recently that Gen Z generation consumes 20% less alcohol than millennials. I was shocked to hear that. So that means they are becoming quite healthy. They are much health conscious because of the social content nowadays we see.
When you said about Gen Z, of late I had gone to a sports event where most of the youngsters were toned, well built, and they're focused on their, build and looks and all those things. So probably the generation is moving into that health where they hit the gym, where they're into lot of exercises, running, cycling, so many activities they have come.
Sometimes we feel very taken back that, okay, fine, we are not doing anything for our health.
Okay.
So, and we can see even in our generation, people above 40 are shifting towards health, self-care, and they're taking care of their health more. I think probably we may reduce this thing, but on the contrary, we are seeing young patients with cancer nowadays more. Okay. So it's probably it's more related to the food intake than to the lifestyle factor.
When it comes to cancer, there is always an emotion quotient that is associated with cancer. Okay. When the word cancer itself is always related to death. So what do you feel? What is that awareness the public needs to have?
See, one thing, it is still curable when it is detected early and treated correctly. See, so because it's a not one-time treatment, we find so many patients falling out with in between. So that becomes very difficult because the process is not complete. You won't have a good body, as simple as that.
Since you have treated many patients from your real life experience, can you just highlight without disclosing the patient identity, the one surgery which is most rewarding and one case which with all, even after all the efforts, the patient couldn't make it up?
Yeah, so we see rewarding is every day, I would say. Every day you treat a patient, it's always challenging. See, so many times the scan doesn't match what we expect in the table. So we have, I remember one patient, we did it in some periphery hospital. I think it was very challenging for me at there because of the setup. Because of the financial constraint, they couldn't come to the city. So I started my practice from outside to inside Mysuru. So we did pancreatic surgery over there, which was not easy, including ventilators we had to arrange, everything. And we had to repair portal vein and everything. But good that we were prepared for everything. I always say, prepare yourself for the what is worst thing which can happen. So then you can, and that day, actually, I still remember that day. The stress, the tension, that kick you get when you do that. And one more case in Bangalore we did, that the doctor's mother, is it?
Yeah.
Okay, so it's like 7-8 years back. So we were declaring inoperable, but doctor's son was standing next to us. And he's like, sir, please do something. And my hands were tied. Because sometimes disease is what it is, I always say. So these are some of the events which still stick in my mind. How, we always like, what best we could have done, what thing we can do. So that always stays as a doctor to in any profession, any field of doctor, I think.
True. When it comes to people living in cities, metros and all, okay, health insurance awareness is there. But when it comes to villages and remote areas, so do we have any schemes that will help them, to combat the
definitely.
economy?
See, that's what I told. Government is constantly in force to help people in their health. But the thing is, because of the way the treatment of cancer is evolving and new cancers are coming up, it's very difficult for any organization to keep a pace with it.
Okay.
See, we have Ayushman Bharat, we have CGHS schemes and so on, which will help poor people who have below poverty line. We have BPL, so they get most of the treatments.
Oh, that's really...
that's one thing. So, but the thing is, we as a doctors we know that there is a better treatment, which has come 2 years back, 3 years back, and it is not included. so which has better results too. So that makes us in a loop sometimes. So that's why I told. So you need to have something extra. I've kept an FD of 10 lakhs. You need to have something 10 lakhs in cash, because that cannot only save you so many in a financial crisis. So you have an Ayushman card, but try to get some insurance. It's nowadays it is very affordable. I tell people, especially who eat non-veg from my place, and I tell, don't eat non-veg 1 week, you skip it. It costs around 800 to 1,000 rupees. That comes to 12,000 rupees in a year. You can get at least 3 lakh insurance for your family.
True.
So they need to take care of it. So you need, if you have 2-3 options, it always helps. So when there is insurance, they can take up new treatments, whatever which has come up in recent times and so on.
That's really nice insight what you gave to public. Let's move on to a section where we have some myths and facts. Let's see, you can debunk some myths what people have. I'll say a statement, you tell us if it's a myth or a fact, and you can give your explanation.
Yeah, okay.
Cancer always means death.
No. Like I said, early detection, we have a lot of patients who are treated, living normal life and so on. It's not.
It's not. Early detection can save life.
Definitely. That's the key. So that's why you need to screen yourself very often, properly, so that you can detect it early.
No pain means no problem.
No, like I said previously. So pain doesn't define if you have a cancer or not. Okay. It's just a symptom. That's all.
Lifestyle affects cancer risk.
Definitely. Having good lifestyle is very, very important. So it can prevent and even postpone cancer.
Okay. At this point, can I ask you, just for an example of for public, what exactly is your lifestyle?
My food is not so good because of the timing of my work.
Okay.
So I try to keep my lifestyle. I've tried to adopt. In recent, like I said, when you reach 40, you try to change, and I'm trying to change my lifestyle.
Okay.
Trying to dedicate 1 hour to my body, and try to carry food from home like what my dad used to do, which I was not doing it.
Okay.
So I'm trying to do that. Only problem which occurs is because we are surgeons, especially in cancer surgery. Surgery is long hours. We expect it to happen in 2 hours. Sometimes it goes to 4. It sometimes goes to 6. In that sense, it becomes very irregular for us.
Okay.
So we trying to keep up with that. Hopefully, I think I will set my routine.
So even as doctors, we are struggling.
I told you, doctors are the worst patients. We preach, but we don't follow so many things. I think somewhere we need to find that balance through down the line.
Biopsy spreads cancer?
No. We get this lot. Okay. Usually there are only 2-3 sectors where places where we don't do biopsy as such, especially in testis cancer, ovarian cancer, in initial stages of ovarian cancer, and sometimes in kidney cancer. So, and even adrenal, we call it, about the kidney. These are some of the places where we don't do biopsy. Okay, but remaining everywhere, because we have got even blood tests to diagnose those. Especially ovarian and testis cancer, we have blood tests. So we don't so many times require biopsies to diagnose that. And most of the places you need biopsy. Without knowing in cancer, there is 2 important things: stage and character. Without knowing the character, it's very difficult to give good treatment. So you need to have a biopsy, and it doesn't spread.
When you have uttered the word staging, okay, probably most of the public are scared about staging. So when do you think it's little recoverable, or if you can get it back to normalcy?
It is stage 1, stage 2.
Okay.
You have high chance of curing. As the stage goes on, the cancer curing percentage comes down. Because disease has gone beyond 1 point.
Okay.
I always relate my examples to the field, because we get a lot of people from agriculture background.
Okay.
See, ಈಗ ಕಳೆ ಬೆಳೆದಿದೆ, ಕಳೆ ಒಂದು ಕಡೆ ಬೆಳೆದಿದ್ರೆ ಬೇಗ ಕಿತ್ತಾಕಿ ಭತ್ತ ಉಳಿಸ್ಬೋದು. If it has grown everywhere, ನೀನು ಎಲ್ಲ ಕಡೆ ಬೆಳೆದಿರೋ ಕಳೆ, chance of yield is less. So your crop will die eventually. So it's all depends on the stage. How much
example.
Results depends on that.
Only older people get cancer. I think we have spoken on that.
Yeah. Yes.
Screening are important even without symptoms.
Yeah, screening is done in people who don't have symptoms. The meaning of screening defines tests which are done to diagnose patients who are having a normal lifestyle.
Okay.
Normal, without a symptom. You have a symptom, it becomes diagnostic test.
True.
not a screening.
If symptoms go away, everything is fine.
No. So many times, especially in abdomen, in otelli, you don't get symptoms if till beyond one point. There will be a silent cancer sitting there, or it might, So you need to support it with investigations.
That was really amazing insight into cancer and public awareness. When we come to the last stage, you just have to say what comes to your mind. Okay, this is called as rapid fire round. Okay. So cancer care in one word.
It's a mental and physical battle.
One thing people should never ignore.
Any signs and symptoms, like I said, which initially I mentioned. So any signs and symptoms, don't self-medicate yourself. Try to visit your specialist. It's fine. A proper specialist, so that they can be guided properly for the further.
That was awesome, Dr. Nischal. You really gave awareness to public in length and breadth. I think most will get a lot of information from this discussion, and probably many lives will be saved with early detection and screening.
They should. Yeah. I thanks for having me here. I really enjoyed the talk what we had. I thank Brindavan Hospital for this opportunity. Thank you, sir.
So as we saw, early screening, early detection saves more life. At the same time, having a good routine, consistent routine and a healthy lifestyle can save life too. And the final thing is invest in yourself, invest in your health. Thank you so much.